Hi, I'd like to welcome you to the Comfort Windows Open Enrollment presentation. These benefits will be effective January 1, 2022, and the open enrollment period is from November 15th through the 26th. I'm Lisa Panisi-Wandel with Haler, Fryer & Kuhn, and we are your insurance broker, and I will be walking you through this presentation. I'd like to let you know of the benefits that are available to you beginning January 1. It's your medical insurance, your health savings account, your dental and vision, which is switching from the Emeritus Network to the Guardian Network, as well as we are adding a brand new voluntary short-term disability plan, and the life, accident, critical illness, and telemedicine. How you're going to enroll into these plans is going through the Paycom enrollment system. You should be familiar with this from either being a new hire and having to do it when you elected your new hire benefits, or from the enrollments that you have done in the past. If you have any questions, please feel free to reach out to us. We'd be happy to help you, but it is a self-service system. This is a passive enrollment, so this year, if you are not making any plan changes, you're not adding any dependents, removing any dependents, you do not need to do anything. But if you would like to go in and look at the benefits, make any changes, or add any of the benefits that are available, please feel free to do that in this system. Excellus Blue Cross Blue Shield is the medical provider that you've had in the past and will continue to have benefits through. This slide is just to let you know of the customer service number that you can call, or you can log in online to find a doctor, provider, or facility that is in network. It's always the best way for you to get savings, as well as we wanted to provide the 24/7 nurse line number. So if you have a sick child, maybe spiking a slight fever, you're not sure if you should take them to urgent care or to the ER, you can always call this number, get advice, and they would be happy to help you with any of those services. Now, I'd like to talk to you about the Blue Cross Blue Shield plans that are available to all the employees. There is the high deductible health plan and the hybrid plan, no matter what location you're in. Now, there are services that are covered at 100%. You do not need to meet the deductible or pay any co-insurance or co-pays. And there are services such as an annual physical, your immunizations, your well child visits that you can get free of charge. All other services, as you are aware, are covered, but they're either going to hit your deductible, or you're going to have your deductible and then a copay afterwards. Now I'd like to talk to you about the cost difference between these two plans. The way I always look at these plans is you're either going to pay less out of your paycheck and more when you go to see the doctor, or you're going to pay more out of your paycheck and less when you go to see the doctor. But the one thing that I do like to point out with this, these two plans is when we're looking at an employee-only level, that if you look at the bottom of the chart, it's going to tell you the total annual maximum spend, worst case scenario. So if you hit the deductible and out-of-pocket maximum plus the cost of your insurance for the entire year, it would cost you $6,277 under the high deductible health plan. Under the hybrid plan, same scenario, you would be spending $9,834. So I do understand that high deductible health plan, that's a lot of money. But just want to point out that in the end, worst case scenario, you would actually be saving money on that high deductible health plan. And there is another way also to help cover that deductible, and we will be talking about that next. And how you can help cover that deductible is by using your health savings account. So you can put money into your health savings account. The maximum for 2022 for a single is $3,650, and for a family, $7,300. What this does, it does help lower your taxable income. So the way I look at it is I'd rather pay myself this money and save it or use it if I need to, and keep it myself versus paying the federal and state governments this money. The nice part about a health savings account is once you put money in, you do have to use it in order to cover any medical costs. But no matter what you do, the money does transfer with you. It is yours. Once the money goes in, nobody can take it away from you, and you can always use it for any and all medical services going forward. Now, in the Buffalo, Rochester, and Syracuse areas, we do offer an HMO plan. For the Rochester and Syracuse area, we are still going with the Excellus HMO plans. But for Buffalo, we did add new this year, a HMO plan that is offered by Independent Health. HMOs, you have in-network services. The cost is more out of your paycheck, but the copays are $20 when you go see a primary care physician or a specialist. Also, we are switching your dental and vision to Guardian as the network provider. So we wanted to give you some information on that as far as the 800 customer service number and also the website where you can go to find a provider. It's always best to find an in-network provider if possible. It's going to save you the most money that way, as they do have negotiated fees that they've set with these providers. So the provider cannot charge you more than what that negotiated fee is. We are also adding a voluntary short-term disability plan. This plan is excellent in the fact that it covers you if something happens to you and you cannot work due to illness and or injury. So we all know somebody that's been diagnosed with cancer or had that accidental fall and they were out of work for a short period of time. But we need a way to be able to pay our bills and support our family. This is the way that we can do it. There is a New York State disability plan. It pays you a maximum of $170 a week. We all know we can't survive on that. So this plan would help cover an additional amount. If you log into the Paycom system, it will tell you the benefit amount that you can choose as well as the cost. Also want to let you know that the other products, voluntary products, are still available, such as the life, accident, and critical illness. Also, there is a telemedicine product. This is a great service to use in the fact that you can save so much time and money by using this service. You can schedule an appointment, visit them over your phone or via video, and if need be, they can offer you a prescription and have it sent to your local pharmacy. I personally used telemedicine just recently, and within 15 minutes, I had scheduled my appointment, talked to the doctor, and they had called in a prescription for me, and I was able to pick it up on my way home from work. I lost no time from work, didn't have to, take 2 hours off, use my, vacation or sick time in order to schedule it. It was very easy and able to pick it up on the way home and able to continue on with my day. This slide is just to let you know, myself again, Lisa from Haler, Fryer & Kuhn, as well as my counterpart, Jeff, we would be happy to answer any of your additional questions that you might have. Every employee is an individual and does have their own individual needs. So please take our contact information. Feel free to email us or give us a call, and we would be happy to go over your individual situation and help you decide what is the best products and services for you to purchase through Comfort Windows. Thank you and have a great day.